Good evening everyone, welcome back to GDC Classes. Hope you all are doing good. So today I am back with my another video lecture on medicinal chemistry, and the topic for today is the drug acting on the antiarrhythmic agents. Now this antiarrhythmic agents, they comes under the topic CVS or the cardiovascular system. Now this cardiovascular system is a very important topic in itself, and even for the competitive exams plus the semester examination, so studying this also becomes very important. Okay, so we'll start with the antiarrhythmic agents first with the definition of the cardiac arrhythmia. Now, what is cardiac arrhythmia? Basically, whenever there is a disturbance in the impulse generation or the conduction, and due to that there is abnormality in the heart rhythm, that condition is called as cardiac arrhythmia. In this, basically, the heart rate can be too fast, too slow, or irregular. Okay, now there are different types of arrhythmia based on this abnormality in the heart rhythm. First is the bradycardia. Now the normal heart rate for an individual is 60 to 100 beats per minute. So whenever this heart rate is below 60 beats per minute, that condition is called as the bradycardia, and when it is more than 100 beats per minute, that condition is called as the tachycardia. Okay, now third is the ventricular tachycardia. Now whenever this heart rate is too fast and that heart rate imbalance starts from the ventricular region or the lower region of our heart, that condition is called as the ventricular tachycardia. Okay, and the fourth is the atrial flutter and fibrillation. Now whenever there is the irregular rhythm or often the too fast heart rate, that condition is called as the flutter and fibrillation. And when this flutter and fibrillation, it is starting from atria or the upper part of the heart, that condition is the atrial flutter and fibrillation. Okay, now the next is the causes of arrhythmia. Now what are the causes why this arrhythmia is happening? First is the ischemic heart disease. Now ischemia is the lowering of the oxygen level in the blood. Now that can also be the cause of the arrhythmia. So ischemic heart disease, this basically happens after the myocardial infarction. Okay, then we have the electrolyte imbalance. Now this electrolytes, they plays a very important role in the cardiac rhythm, in maintaining the cardiac rhythm. Okay, so whenever there is an imbalance in these electrolytes, they can be the cause for this arrhythmia. Then we have the drug toxicity like of digoxin and the antiarrhythmic drugs, they can also be the cause of these cardiac arrhythmia. Then we have the congenital heart disease. Then we have the hyperthyroidism. All these are the causes for the cardiac arrhythmia. Then here we can look to the picture. This is the normal heart rate. Okay, how the heart beats. Then here we have the tachycardia condition where the heart rate is too fast. Okay, then here we have the bradycardia, here the heart rate is too slow. Then here this is the irregular condition or the irregular heart rhythm where somewhere the heart rate is too slow and somewhere it's too fast. Okay, so that is called as the irregular cardiac arrhythmia or the irregular rhythm in the heart. Now the cardiac conduction pathway, how it happens. Now this is the normal cardiac conduction pathway, how the impulse is passed on in the heart. Okay, so it starts with the SA node or the sinoatrial node. The sinoatrial node is also called as the pacemaker of the heart, and this is responsible for the impulse generation. Now the impulse, when it is generated at the right atrium, here the SA node is situated. Now whenever the impulse is generated, it is passed on to the AV node. Okay, the atrioventricular node. Now this passes the impulse to the bundle of his hair, and then to the right and left bundle branches, and that pass on to the Purkinje fibers. Okay, now this is how the conduction system, or the impulse is passed on in the cardiac system or the heart. Okay, now this conduction, now whenever there is a disturbance in this conduction, okay, that condition is called as the arrhythmia. Now, moving forward, we have the phases of the cardiac action potential. Now, how this action potential takes place, there are different phases, basically 5 phases, phase 0, 1, 2, 3 and 4. Now, starting with the fourth phase is also called as the resting membrane potential. Now, it starts at minus 90 microvolt. Now here this region is called as phase 4, okay, and this occurs at minus 90 microvolt. Okay, now here the region, this is also called as the polarized region. Now here whenever we get a signal from our brain, then there is a generation of an impulse. Okay, now then second phase we have is the phase 0. Phase 0 is also called as the depolarized phase, or depolarization occur here. Now how does depolarization occur? It basically occurs due to the opening of the sodium channel. Okay, so whenever the positive charge inside our cell or inside our membrane increases, now that condition is called as the depolarized state. Okay, so here this is the phase 0 and this is also called as the depolarized state, as here the voltage gated sodium channels, they open and the sodium, they rush in. Okay, and there is the increase in the level of positive charge inside the membrane, and due to that the condition of depolarization occurs. Okay, and there is a spike on the graph. So this here is the phase 0 or the depolarized state. Then we have the phase 1. Phase 1 is also called as the initial repolarization. Okay, now why initial repolarization? Basically here the sodium channel, they close. Okay, the sodium channel, they close, that were opened in the phase 0. So whenever there is increase in the level of negative charge inside the membrane, that condition is known as polarization. Okay, and if the polarization, it takes keep on taking again and again. Okay, so before also the polarization has taken place, now again the polarization is taking place. Now that is called as repolarization. Re means again. Okay, so this is the initial repolarization state. Here the sodium channel, they close and the potassium channel, they open. Okay, so whenever the potassium channel open, there is an efflux of these potassium channels outside the membrane, towards outside. Efflux is there. Okay, so the negative charge inside the membrane increases, and due to that repolarization takes place, and it takes place for a very small time. Okay, and it is basically the initiation or the initial repolarization. Okay, so here that I have marked red here, this phase is called as the phase 1. Okay, and also called as the initial repolarization state. Now the next phase we have the phase 2. Now here the potassium channels, they keep opened, so the potassium channels keep on moving outside, that is the efflux of the potassium channel is going on, and here at phase 2 the calcium channels also open. So there is a balance. The amount of potassium that is moving out is equal to the amount of calcium that is moving in. Okay, so the charge is balanced here. So that's why this phase is also called as plateau phase. Okay, so here influx is equal to efflux. Okay, that is the phase 2. Here this is the phase 2. Okay, now the last phase we have here is the phase 3. Now phase 3 is the repolarization state. In this, the calcium channel closes and the potassium efflux increases. Okay, the potassium channel are still open and the efflux is increased. So as the potassium is moving out faster, then the negative charge inside the membrane, it increases, and due to that we get a repolarization state, or we can say a polarization state we get. So that's why this phase 3 is called as the repolarization. Okay, so this here phase 3 is the repolarization. Okay, now after the repolarization, the impulse or that uh, cardiac system, it again moves to the phase 4, or called as the resting potential. So this phases, or the impulse, it keeps on moving like this, and it continues with these 5 phases. Okay, phase 0, phase 1, phase 2, phase 3, and then phase 4. Okay, so here now we have a ECG, that is the electrocardiograph. Here I have mentioned. Now the phase 0 and the phase 1 are called as the QRS complex. Okay, so in this graph, this is the graph we get through the electrocardiogram. Okay, so here we have the Q, this is the Q, this is the R, and this is the S. Okay, so this complex is called as, this complex covers the phase 0 and the phase 1. So basically depolarizations occur here. So this QRS complex, depolarization occur here, and this tells us about phase 1, phase 1 and phase 0. Then second we have the phase 2. Basically this ST segment here, the S and T segment, this is called as the phase 2, or we can also say the plateau state. It tells us about the plateau phase. Okay, then the third phase we have the T wave. Now the T wave tells us about the phase 3, and here the repolarization, it shows the repolarization that is occurring. Okay, so this was about the ECG graph. Okay, or we can say ECG pattern. Now, next we have the classification of these antiarrhythmic drugs. Now, this classification is by the 𝙂𝙋𝘼𝙏. Okay, according to the 𝙂𝙋𝘼𝙏, he gave this classification. He basically classified the antiarrhythmic drugs into the 4 classes. Okay, now out of that, the first class is the membrane stabilizing agent. Okay, so these membrane stabilizing agents, they basically act by blocking the sodium voltage gated sodium channels. Okay, now sodium channels were only responsible for the depolarization. Okay, now as these sodium channels are blocked, then the depolarization will not occur for that particular time till they are blocked. So this class 1, it acts by blocking the sodium channel only. It is basically divided into class 1A, class 1B, and class 1C based on the strength, how they are blocking the sodium channels. Now the first A1, the class 1A, it is the moderately acting. Okay, then class B, it is the weakly acting. Okay, and class C, it is the strong acting. Okay, so based on their strength, they are divided into A, B, and C. Okay, now next on we have the next class, that is the antiadrenergic agents, or we can also say the class 2 is the beta blocker. Okay, now beta blockers, they basically act by reducing the heart rate, hence they also help in in curing the arrhythmia. Okay, so basically the LOL drugs comes under this class, that is the class 2. They are also called as the beta adrenergic blockers. Then the third class we have here is the agents that widen the action potential. Okay, so they basically act by blocking the potassium channel. Okay, the potassium channel, that is responsible for the efflux of the potential, efflux of the potassium that results in the polarization. Okay, so as this potassium now is blocked. Okay, so this is the mechanism of action of the class 3 agents, or the class 3 antiarrhythmic drugs. Then we have the class 4 drugs that are the calcium channel blockers. Okay, now the calcium channels are working here. I'll show you on the phase 2. Okay, so they were responsible for this plateau phase. Okay, so here the calcium channels blocked. Okay, so that can also result in treating our arrhythmia. Okay, so fourth class is the calcium channel blockers. Basically the verapamil and the diltiazem are the drugs here. Okay, now starting with the drugs one by one that are important. Okay, that I felt important. Okay, now this classification chart I have taken from the K.D. Tripathi book. Okay, and even some content also from K.D. Tripathi. Okay, so let's start with the drugs. First drug is the quinidine. It belongs to the class 1A sodium channel blocker. Okay, now quinidine, if we talk about its structure, now quinidine contains a quinolone ring in its structure. Okay, so from quinolone ring you can remember that is a quinidine. Now if we talk about the uses, it is a class 1A antiarrhythmic agents. Okay, now it can be useful in the atrial fibrillation that we discussed. Okay, whenever there is an irregular beat, or often whenever there is a fast heart rate and that starts from the atria, that is called as atrial fibrillation and flutter. Okay, then we have the ventricular arrhythmia. Okay, when the arrhythmia is basically happening due to in the ventricle region or the lower region of the heart, that is called as the ventricular arrhythmia. Then we have the paroxysmal supraventricular tachycardia. Now paroxysmal means time to time it is repeating. The paroxysmal meaning that time to time it is repeating. Okay, supraventricular means above the ventricle. Now what is above the ventricle? That is atria. Okay, so whenever there is the heartbeat that is fast. Now tachycardia means fastening of the heartbeat. Okay, so whenever there is fastening of the heart rate and that is to the supraventricular region, means at the atria, and that is happening again and again, that is called as the paroxysmal supraventricular tachycardia. Okay, then it can also be used in malaria, but it has a rare use there. Okay, then we have the Brugada syndrome. Now it is also now this Brugada syndrome, it is basically the genetic disorder. Okay, genetic heart disorder, this Brugada syndrome, and it has a off-label use. Okay, not officially it is used for that particular syndrome, but off-label use, it can also be used for treating the Brugada syndrome. Then the side effects, we have the torsade D point. Now whenever the QT interval it is prolonged, that causes the torsade D point. Okay, now QT interval means here let me show you. Here is Q and here is T, means when the time, the prolonged, if the from Q it's starting the phase 0, phase 1, phase 2, phase 3, then all phases are combined under this QT interval, and whenever there is a prolongation of this period, okay, so basically that is called as the torsade D point, and it can be dangerous at many times. Okay, then we have nausea, vomiting, diarrhea, headache, confusion, hypersensitivity. All this can also occur due to this quinidine as their side effect. Okay, now the second drug we have here is the procanamide. Okay, now procanamide is formed from the two words, that is the procane, okay, plus amide. Okay, so whenever we add an amide group to the procane structure, that is called as the procanamide. So if we add an O here, okay, now this is procane. Now in this procane, if we want to add amide, so here if we, in the place of O, we replace that O with N. Okay, now this structure is the procanamide structure. Okay, then if we talk about its uses, it is also used in the ventricular tachycardia. Okay, then atrial fibrillation and flutter, then supraventricular tachycardia again, okay, then diagnosis of the Brugada syndrome, it can be used for that also. Side effects, again we have the Torsades D point, agranulocytosis. Now what is this agranulocytosis? Basically when these granulocytes, okay, in granulocytes also the neutrophiles, if their number is decreased, okay, if there is the decrease in the number of these granulocytes, that condition is called as the agranulocytes, okay. Now then basically they are used to fight against the uh, foreign materials that are entering our body, okay. So if the number is decreased, then it can be problematic. Then we have the drug induced lupus erythematosus, okay, that can for that it can also be the side effect for that. Then we have the nausea, vomiting, dizziness, headache. Then we have hypotension, all that by the procainamide, okay. Now the next we have is the 𝙤𝙎𝙎𝙬. Okay, now 𝙤𝙎𝙎𝙬. Now if we look onto its structure, we have a 2-isopropyl group. Okay, from its name we can say from di-iso. Okay, di-iso-pi. We can say it has a 2-isopropyl groups. 2-isopropyl group. Where are these? Here. The 2-isopropyl group. Di means 2, iso means this pattern, okay, the iso, and what iso? The propyl. We have 2 isopropyl groups in its structure, okay. Then from pyramide, or we can say from pyra, we can remember that it contains a pyrimidine ring, okay. So here we also have a pyridine ring, not pyrimidine, sorry. The pyridine ring is present in its structure. So from pyra we can remember the pyridine ring, okay. Then amide, here amide. So here also in its structure also we have amide. So this is the diisopyramide structure. Then uses, it can be used in the ventricular arrhythmia, okay. Then the atrial fibrillation and flutter, it can be used there. Then the hypertrophic obstructive cardiomyopathy, for that also we can use it. Then we have the paroxysmal supraventricular tachycardia, we already discussed about that. For that also it can be used. Side effects, again the Torsades D point is the side effect for that. Dry mouth, constipation, dizziness, headache, then hypoglycemia, okay, rare. The hypoglycemia is rare, but it can be serious at times, okay. So that is also an important to know that it is the side effect for this diisopyramide, okay. The next drug we have is the lidocaine. Now lidocaine, you have also studied this, or you must have heard this in the anesthesia, okay. So this lidocaine, it acts as a local anesthetic too, okay. For the dental surgery and all, we use lidocaine. Now if we look onto its structure, it has a phenyl ring that has 2 methyl groups attached, okay. It has a amide group plus an amine with 2 ethyls attached, okay. So this is the lidocaine structure. Then we have uses. It comes under the class 1b antiarrhythmic agents, okay. So it is from the class 1b, so its action or its strength to block the sodium voltage gated sodium channel is very weak, okay. Then if we talk about the uses here, antiarrhythmic, it can be used in antiarrhythmic also, ventricular arrhythmia, it is used for that. Then the drug toxicity, the digitalis induced arrhythmia, it can be used for the treatment of that. Then it has an action as a local anesthetic too, okay. Then side effect, if we talk about, bradycardia can be the side effect for this lidocaine. Then the hypotension, arrhythmia, overdose, okay. If we have overdose of this lidocaine, then it can cause arrhythmia too. Then heart block, CNS toxicity with overdose. Again, if we take it overdose, then we have the CNS toxicity. CNS toxicity, like, it can be mild, it can be severe. Tingling, dizziness, tremors. Okay, these are milder CNS toxicity, but it can also cause confusion. It can also cause seizure, then respiratory depression, then even coma can be caused if the dose is too high. Okay, that is all about lidocaine. Then the next drug we have here is quinidine done, lidocaine done. Then the next we have the mexiletine. Okay, now mexiletine is the another drug. Again, this also has the same ring as the lidocaine. Okay, like here we also have a phenyl ring with two CH3s. Here also we have a phenyl ring with two methyl groups attached. Okay, then here we have the ether bond, okay, in this mexiletine, and then we have an NH or amine group that is attached to the carbon. Okay, so this is the structure of the mexiletine, or we can say the ethyl group is here. Okay, we have two carbons here, so ethyl group that is attached to the amine group. Then we have an ether group here that is attached to the phenyl ring that has two methyl attached to it. That is the structure of mexiletine. Then uses, again, the ventricular arrhythmia, the neuropathic pain and muscle stiffness, it can be used. Side effects we have the dizziness, the tremor, and then ataxia, nervousness. Then we have blurred vision. Okay, seizure can also occur. Now seizures are rare, but they are dose dependent. If overdose is given, okay, so in that condition it can even cause seizure like conditions. Then nausea, vomiting, and it can even worsen arrhythmia. Now this also happens due to the overdose only. Okay, the worsening of the arrhythmia. Now the next we have the propafenone. Okay, now propafenone is the next drug. Now from its name we can remember its structure. So from propa we can remember propane. Okay, so here we have a propane, meth, eth, prop. Okay, the three carbons, that is propane we have here. Okay, now this propane is with on. So from on, now on suffix we use it whenever there is a ketone. Okay, so propane, it has a ketone. Okay, so propanone we have, so propane with a ketone group we have. Then phenone, in the name we also have a phenone. Now this phenone, it sounds like phenyl. Okay, phenyl. Okay, so we also have a phenyl group here. Okay, so that is the structure of propafenone. Okay, then uses, if we talk about atrial fibrillation, it can be used. Then paroxysmal supraventricular tachycardia, again in the atria region, if we have to, in the atria region, if the tachycardia is starting. Okay, so that is the paroxysmal supraventricular tachycardia, and that is occurring time to time, that is occurring again and again. So that's why paroxysmal. Then we have the ventricular arrhythmia, it can be used for that also. Side effects, worsening of arrhythmia in the case of overdose mainly. Okay, then bradycardia, dizziness, headache, fatigue, nausea. Then metallic taste can also be the side effect here. Then constipation is the side effect. Okay, now the next drug we have the propranolol. Now propranolol, it comes under the second class of the antiarrhythmic drug, that is the beta blocker. Now how we identify the beta blockers? Basically all the beta blockers, they have lol at the end of their name. Okay, so this is the beta blocker, the propranolol. Now beta blockers, they basically have two backbones that are present. Okay, so all the beta blockers, either they will have one of the backbone. Okay, now first backbone is the aryl ethanolamine. Okay, first is this backbone, and second is the aryl oxypropanolamine. you just remember these two backbones and you will able to make all the structures of the beta blockers. It will be very simple for you to learn the structures of the beta blocker if you know these two backbones. So basically this propranolol, it comes under the aryl oxypropanol amine backbone. Okay, it has this backbone. So first we'll look on to the name. We have a prop. Okay, so from prop and all we can say it has a propanol group. Okay, so meth, eth, prop, it has a propanol group. Okay, and from NO we can say it also has a side chain, that is naphthalene. Okay, so naphthalene is the side chain. Okay, so this was about the name. Okay, now look on to the structure. The aryl oxypropanol amine, aryl oxypropanol amine backbone. Okay, so this is the aryl group. Now aryl group changes, okay, depending on the different types of beta blockers. This aryl groups changes. Okay, so this aryl group here is the naphthalene that we have already said from the NO. We have already remembered it from NO that we have a naphthalene. So this is the aryl group. Then we have oxy, so we have an oxygen attached here. Okay, then we have propanol amine, so meth, eth, prop, propanol. Okay, so we have aryl oxypropanol. Then we have amine group attached. So this is the structure of propanol amine. The propranolol, that has a backbone, that is the aryl oxypropanol amine. Okay, so this was all about the structure of propranolol. Now uses, it is used in arrhythmia, it can be used in hypertension, in angina pectoris, then migraine prophylaxis, anxiety. For all that we can use propranolol. Okay, then side effects, bradycardia, hypotension, it can worsen heart failure. Okay, then we have bronchospasm. Now why bronchospasm? This is basically due to the action of the propranolol. Now this propranolol is a beta blocker. Now it is not a selective beta blocker but a non-selective beta blocker, means it will act on beta 1 plus beta 2. Okay, now as it is acting on beta 1, that's why it has an action of antiarrhythmic. Okay, that's why it is acting as an antiarrhythmic drug. But as it also has the action on beta 2 receptor, now as the beta 2 receptor is blocked. Okay, now due to this blocking of the beta 2 receptor, it causes the vasoconstriction. Okay, now due to this vasoconstriction, we have the not vasoconstriction, sorry, the bronchoconstriction. Okay, so beta 2 receptor, it is basically present in lungs. Okay, so there it causes constriction of the bronchioles, so it caused the bronchoconstriction, and due to that constriction, we have the bronchospasm as the side effect for this propranolol. Okay, and now why this is happening? Due to its non-selective nature. Okay, now hope that's clear. Then fatigue, depression, then sleep disturbance, vivid dreams, then masking of the hypoglycemic symptoms. Okay, then nausea, diarrhea, withdrawal can all be the cause for this propranolol. Okay, now next drug we have is the esmolol. Now it also has lol as its suffix. The prefix, it has the lol. Okay, so this also comes under the class that is the beta blocker. Okay, now this also has the same backbone, that is the aryl oxypropanol amine. Okay, so here we have a aryl group. Okay, here we have a oxy group. Here we have a propane, meth, eth, prop, enol. Okay, and here again we have a amine. So esmolol. Okay, that is the aryl oxypropanol amine backbone. Okay, from S we can remember it has a ester group. Okay, now ester group where? In the aryl, if we are talking about the aryl oxy, so that aryl, it has an ester group. So here we have a ester that is attached to the benzene ring. Together it forms the aryl group that is attached to oxy, then propanol, then amine. So that is the structure of esmolol. Okay. Then the uses we have the supraventricular tachycardia, it can be used there. Then atrial fibrillation and flutter again. Then hypertensive emergency. Then we have the pre-operative tachycardia or hypertension, it can be used there also. Then side effects, bradycardia can be side effects, sometimes the hypotension. It can also worsen the acute heart failure. Okay. Then fatigue, dizziness, nausea, all that can also be caused due to the intake of this esmolol. Now next drug we have the amiodarone. Now amiodarone, this comes under the class 3 antiarrhythmic drug. Okay. So it basically acts by the prolongation. Okay. Or we can also say they are the potassium channel blockers. Okay, the potassium channel that is responsible for efflux, and that results in the polarization. Okay, the polarization phase, for that the potassium channel is, or the potassium electrolyte is responsible. Okay, now if we look onto its structure, it has a benzofuran ring in its structure. Okay, the benzofuran ring, you just remember that amiodarone has it. Then from AM we can remember it has an amine group. Okay, so it has an amine group here attached. Then from iode, Me iode, from iode we can say it also has an iodo group. Okay, the iodine, we have two iodine groups in amiodarone. Okay, then it has on as its suffix. Okay, as it has on means it has a ketone group attached. So with this benzofuran ring we have a ketone also attached here. So this is the amiodarone structure. Okay, it is a potassium channel blocker. Okay, now uses ventricular arrhythmia, we can use it. Then atrial fibrillation, then supraventricular tachycardia, it can also be used there. Side effects, the pulmonary fibrosis, we can use it. Then hypothyroidism, then optic neuropathy. Okay, whenever there is disturbance in the optic nerves, okay, that condition is optic neuropathy. It is a rare side effect, but it can happen. Then tremor, ataxia, then sleep issues, photosensitivity, bradycardia, all that are the side effects for amiodarone. Now the next drug is the dronedarone. Okay, now dronedarone also has the benzofuran ring in its structure. Okay, plus the sulfonamide group 2, the dronedarone. Now uses, it also comes under the class 3 antiarrhythmic drug only. It also acts by the potassium channel blocking only. Then uses atrial fibrillation, atrial flutter, rate and rhythm control. For all that we can use this. Side effects, bradycardia, worsening of heart failure, then nausea, vomiting, diarrhea, abdominal pain, all that. Then next drug we have sotalol. Now this drug has lol at its suffix, so it should be the beta blocker, that is the class 2 antiarrhythmic drug. But the sotalol has the two actions, that is it can act on as a class 2 antiarrhythmic also and as class 3 antiarrhythmic too. Okay, so it acts by blocking the potassium channel 2, plus it acts by blocking the sodium channel, the voltage gated sodium channel 2. Okay, the sotalol. Now if we talk about its structure, now again the same backbone. Now it has the aryl. Now there are two backbones, the aryl oxypropanolamine that we have already studied in propranolol and esmolol. Now in sotalol we have the aryl ethanolamine backbone. Okay, now let's look on to its structure. Now this is the aryl group, this is the ethanol group, and this is the amine group. Okay, so this is the sotalol, the aryl ethanolamine. Okay, now we should remember the side group. Okay, the side chain what we have in sotalol. So from sota we can say it has a so means S and O. sulfur and oxygen. From Ta we can remember 2, Ta2, okay, so SO2. So we have a SO2 group, or we can also say we have a sulfonamide group in its structure. The sotalol has a sulfonamide group in its side chain that is attached to the benzene ring. Okay, now this benzene ring plus the sulfonamide together they form the aryl group. Then we have the ethanol, and then we have amine. So this becomes sotalol, the aryl ethanolamine backbone with the sulfonamide group attached to it as a side chain. Okay, uses the atrial fibrillation, then we have atrial flutter, then ventricular arrhythmia, then we have pediatric arrhythmia, we can use it there. Then side effects, torsade T-point again, then bronchospasm, fatigue, dizziness, headaches, nausea, vomiting, all that are the side effects for sotalol. The next drug we have here is dofetilide. Dofetilide is the next drug we have. It uses atrial fibrillation, atrial flutter, heart failure, all that. Then side effects again, the torsade T-point, then headache, bradycardia, dizziness, chest pain, nausea, diarrhea, all that can happen due to the dofetilide. Then the next drug we have verapamil. Now verapamil, it belongs to the last class, that is the class 4 drug, that is the calcium channel blockers. So this verapamil is a calcium channel blocker. Okay, now it has the uses. It can be used in the supraventricular tachycardia, okay, then the atrial fibrillation and flutter, angina, hypertension, migraine prophylaxis. For all that we can use this verapamil or the calcium channel blocker. Then the side effect, bradycardia, hypotension, worsening of the heart failure, constipation, nausea, headache, dizziness, fatigue, and plus it can also cause the peripheral edema. Okay. Then the next drug we have the diltiazem. Now diltiazem also belongs to the class of the calcium channel blocker, that is the class 4 antiarrhythmic drugs. Okay, uses the atrial fibrillation, it can be used there. Then flutter, okay, the atrial fibrillation and flutter, for both it can be used. Paroxysmal supraventricular tachycardia, we can use it. Hypertension, angina pectoris, alternative to the beta blocker. Now it can also be used an alternative to the beta blocker in the asthma patients. Now in the beta blockers, if you remember, I told you that along with acting on the beta 1, it also acts on beta 2 due to its non-selective action. Okay, now as it is acting on the beta 2, on blocking the beta 2 receptor, now due to that there is the bronchoconstriction. Okay, so they are having the bronchoconstriction, and that bronchoconstriction is not favorable for the asthma patients. It can worsen their situation. So whenever there is an asthmatic patient, for that we can use this diltiazem in place of the beta blockers. Okay, then the side effects we have the bradycardia, hypotension, nausea, constipation, dizziness, headache, fatigue, peripheral edema. Okay, I already told you calcium channel blockers show the side effect peripheral edema. That is a very common side effects that basically all the calcium channel blockers show. Now these are the drugs that we have that comes under the class the antiarrhythmic agents. Okay, so in this class I only want to discuss these many drugs. There are many drugs more, but I found these drugs were important, so I have discussed these. Okay, so if you have any problem you can ask me, and hope you understood the lecture. Thank you so much for watching the lecture. Okay, thank you so much.